Thank you, and good morning. Welcome to the joint CERS-KRS Retiree Health Plan Committee for May the 8th. At this time, I'd like to call the meeting to order. Uh, Ms. Bass, would you mind reading the opening statement?
Of course, Mr. Powell. For the record, I want to note that this is a regular meeting of the Joint Retiree Health Plan Committee of the County Employees Retirement System and the Kentucky Retirement System. This meeting is being broadcast via video teleconference pursuant to Kentucky Revised Statute Section 61.826 and may be viewed by the public at the KPPA offices located at 1260 Louisville Road in Frankfort, Kentucky. It is also being broadcast to the public via Facebook. I ask that if you are speaking and are not appearing by video, please identify yourself before speaking. In the event that the video or audio broadcast is interrupted, we will attempt to reestablish a connection. If a connection cannot be reestablished within 30 minutes, the meeting will be adjourned and rescheduled to another date.
Hey, thank you very much. Park, I understand we have no public comment.
Correct.
And that takes us to the next item, which will be the elections. We'll entertain a motion.
Mr. Powell, I'm sorry. Would you like me to do roll call?
Oh, yeah, I probably ought to do that.
Okay, great. Mr. Powell?
Here.
Mr. Fulkerson?
Here.
Dr. Miller? And Mr. Piercing?
Here.
Great, thank you.
I guess that I did that middle one, so but that don't count. They now on into the elections. So I'll entertain a motion for the chair for the Joint Retiree Health Plan Committee.
I'll nominate Jerry Powell.
I have a first
Second.
and a second. Okay. Any other nominations? Hearing none, I'll close the nominations for that. All in favor, Jerry Powell for Joint Retiree Health Plan Chair, I say aye.
Aye.
Aye. Opposed? Motion carries. Next will be the Vice Chair. I'll entertain any motions for Vice Chair for the Joint Retiree Healthcare Committee. Okay.
Can we nominate somebody in absentia? Because I'll certainly do it.
Yeah, I was going to say, who's not here?
Vicky's saying yes. Is that
Yes,
legit?
you can.
Yeah, you
They're
can.
a committee member. You absolutely can.
Well, I would like to nominate Crystal Miller. Second.
I have a first and a second. Any other nominations? The nominations will close then. All in favor for Crystal Miller for Vice Chair of the Joint Retiree Health Plan Committee, say aye.
Aye.
Motion carries. Number 6 will be approval of the committee minutes for February the 15th.
So moved.
Thank you,
Sorry.
sir. Oh, no
I'll
problem. A second. Any
Second.
deletions, corrections, additions? Hearing none. All in favor of approving it as written, say aye.
Aye.
Opposed? Motion carries. Next will be the account management review for Humana. Madam Garrison.
Good morning
is-
again. All right. Well, it's good to see everybody. Thanks for having us. If we can look at the agenda slide, I'll just go through quickly what we're going to cover today. Perfect. So we will begin with an introduction of Personify Health. I'll give you a little bit of comment on that, and then we've got some representatives from Personify Health that will speak with you and introduce themselves. We'll do a review, a high-level review of the 2023 plan performance. We will do, and then we'd like to talk about the 2025 renewal planning and some CMS changes that are coming that we want to make you aware of. So with me today, you all know Larry Lowe, Director of Account Management. I see Carla Whaley is also on. And then Penny Hahn is our Associate Vice President of Actuary and Underwriting. And from Personify Health, we have Jose Coriel, and we also have Casey Rasmussen. So if we can go, probably just two, if you want to advance 2 slides. I'm going to turn things over to Personify Health in just a second, but wanted to just kind of remind everyone, Personify Health will begin working with Humana and KPPA January 1st, 2025. You may recall that Humana is exiting or has exited the commercial group Medicare business, which is the platform that we supported your medical only and mirror plan on. So because of that, we sought additional support so that we can continue to provide those benefits through Humana, Personify Health, formerly known as HealthComp. We did use that name in the past with them, so wanted to let you know they do have some information to share on that. But they will be the administrator of this plan. Humana will continue to hold the contract. We will work with them to get everything set up. And we've actually been working with them for several months now, and are prepared to begin working with the team at KPPA, Connie Pettyjohn and her team, to make sure that everything gets set up so that it's a seamless transition for your members. Any questions about that Humana transition before I turn it over to the team at Personify Health to introduce themselves?
I had a question. Is Personify Health part of Humana or a separate company?
No, they are a separate company, so we will be working with them in a vendor type relationship. Okay, if there's no other questions, Jose, if you want to take it from here.
Welcome, everyone. I want to make sure you all can hear me.
We can hear you.
Yes, perfect. Thank you, Tracy, and thank you for the background that you all gave. My name is Jose Corral. Thank you for your time. I understand you all were on the global stage last week, so we applaud you all for showing a great performance. I am sales vice president here at Personify Health. Been with the organization for over 5 years. Spent the majority of my career in working for insurance companies. I am joined by my manager, Casey, who's going to share with you a little bit of the Personify Health story. But by more background, wanted to share with you that we have actually been working with Humana for over a decade. And we've had the pleasure of expanding as Tracy mentioned, our partnership over the last couple of years. We have successfully implemented several organizations and have, as Tracy mentioned, feel like we have had a running start in ensuring that we smoothly transition all of you folks. We also have had the pleasure of meeting Connie and her team. What a wonderful group of folks. In fact, I loved what she says. You all are ours for life. So our goal is to maintain the service excellence that you all have come to expect from Humana. So we're excited to maintain that, and also the stewardship. So it sounds like both are being met with your Humana partnership. So we're excited. If you flip to just the next slide here, this gives you a little bit of the administration footprint or background. HealthComp and now Personify Health, and you're going to hear a little bit about that story, what brought us together under Personify Health. But we have been the largest independent health plan administrator or third-party administrator in the country. That affords us the opportunity to work with many vendors, insurance companies, networks. We are been in existence for quite some time, and we are proudly serving over 18 million members. So we are welcoming you all to our family of customers. With that, I'm going to turn it over to Casey.
Thank you, Jose. Mr. Powell, the rest of the committee members, it's a pleasure to be with you today. My name is Casey Rasmussen, and I lead growth at Personify Health. I got into healthcare over 20 years ago because I have 4 children, and they had had some pretty serious medical issues. I have a type 1 diabetic daughter, and I have a son who ended up having a heart transplant. So I spent what felt like years of my life as mom on the other end of the phone. And developed a passion for figuring out how to have that experience be better for others. And that's what moved me into healthcare. And I've had the pleasure of working as part of this now combined organization for the last decade on the well-being side of the house with Virgin Pulse. We are really excited to bring this merger together. So the merger between Virgin Pulse, the world's largest global well-being company, and HealthComp, the country's largest independent TPA. That happened in November. And when we kind of went through this merger, we, wanted to take a look at, well, what should we call ourselves? What's really true about our organization moving forward? And so, of course, as all companies do, right, we hired smart people to talk to everybody. So we talked to our clients, we talked to our members, we talked to our employees in all of our various offices around the country and world. And the one thing that came back way ahead of everything else was no matter whether you were being served by us or working internally, it was all about our people. We've had a value across the organization of people matter from the very get-go. It's really written into our DNA. So when we looked as to what we were going to call ourselves or what we were going to really focus on and in our values moving forward, people first is foundationally the most important thing, which is why we are now called Personify Health. We, have put people first, even in our name. And so really looking forward to, how we can serve you and making sure that whether it's, our folks answering the phone and talking with you, whether it is working with Tracy and Connie and team, and supporting you as an organization that way, it really is about people and making sure that member experience and your experience is absolutely as seamless and smooth and supportive as it possibly can be.
And I think, Casey, there is just one more slide, just
Oh,
really
there we go.
highlighting.
There we go. Yeah. So as Jose said, we are, a big company, again, focused on individuals, but we serve 7,500 different companies right now around the world, including 25% of the Fortune 500. Our client size, though, we also serve a ton of clients that are regional and local, that are smaller. So our footprint has a real broad range. We are finding across the board, however, with validated third-party actuarially assessments, that we are saving the folks we work with on average 20% on their healthcare costs, which is considerable. You can see here too, 18 million lives that we're currently working with and supporting, and the languages that we support. We know that health is personal, and people often like to work in the language that works best for them. Our average engagement rate is 50%. One of the things that we've learned is that health shouldn't just start when you enter the facility to, meet with the doctor, that we should be supporting you kind of every step of the way in maintaining your health, and once you have a condition, really supporting the best possible outcome for you. How we get to those health cost savings is really by making sure that we are helping you have the best possible health outcome by getting you to the right doctor at the right time for the right service, and then supporting you along that journey. Obviously, we've got a lot of data analytics happening under the covers there with us and our platform, in terms of our use of AI, in terms of our use of machine learning. And frankly, at the end of the day, it comes down to listening. We spend a lot of time and make sure that we're staffed to adequately have the time to listen. And that's the data that matters the most. So that's fundamental to what we are. It's not just the technology that we have, but it's also the investment we make in our people, so that those that are answering the phones and working with our membership have the time and the support they need to make sure, again, we're having that ultimate member experience. So again, thank you so much for letting us join you today. We're very excited to support your population and work with your team. So thank you for the opportunity.
Any questions for the team? All right, if there's no questions, then we can move to the 2023 plan performance. So what I'm sharing with you today is really a high-level overview of each plan, the premium plan and the essential plan. Just wanted to give you a snapshot of kind of what we're seeing, some of the areas that stood out to us the most and are the most impactful. I will be working with Connie to set up a time to give everyone an opportunity to see the full Plan Compass report in its detail, and bring our medical director in and go over it in step by step, so that you can understand kind of how the plan is performing year over year. But just wanted to give you a look at it today. So starting at the top this is the premium plan. So this is where the majority of your membership is. You can see 54,952 members. That is a 1.5% increase from the prior year. Total net paid per member per month for 2023, $1,537.15. This is a 7.7% increase year over year from 2022. So that is a pretty significant increase from the prior year. If we break that down and we look at, how is that impacted medical expenses versus pharmacy, you can see for 2023 on the medical side per member per month, $934.61, and that is up 3.8% year over year. And then on the pharmacy net paid, it's up to $602.54 for 2023, which is a 14.3% increase. So, we are seeing significant increases in the overall pharmacy spend. The report itself gets into some more detail as far as specialty, but we'll look at a little bit more of that as we go through this chart. Pharmacy, or the medical admits per thousand. Now, this is one area where you have seen some decrease in utilization. So it's always good when we see lower utilization of an inpatient hospital stay, as those are generally very costly. So the admits per thousand for 2023 is 157, down from 162 the prior year at 3.3%. Total number of prescriptions. So getting back to this prescriptions, this plan overall has 2.19 million prescriptions issued for the year. We did see an increase in that of 1.8% overall. So while your number of prescriptions is up slightly, no huge change there. The total number of those specialty prescriptions that are specialty related, and keep in mind, these are the higher cost medications requiring special handling. They can be, $10,000, $20,000 per month, sometimes more. I believe the threshold for this starts at about $4,000 a month, if memory serves me correctly. But the total number of specialty prescriptions is up 9.5%. So 28,144 prescriptions for 2023. And then the specialty net paid per member per month also saw a significant increase. It went up to $225.10 per member per month, so a 10.6% increase there. Moving away from the specifics on the medications, health alerts, fully compliant. We saw a great uptick here. Just a reminder, health alerts are the reminders that Humana sends out to your members. Sometimes it goes to the pharmacist to make a reminder. Sometimes it goes to the member's primary care physician or specialist. So if they need to have an A1C done, a reminder about flu shots, various different other, messaging based on their health conditions. So great increase there. And I think this is the overall trend that, we do see with your membership. They do respond well to Humana when we do reach out. So we're up to a 61.7% compliance, and that is full compliance, meaning that they have, that's the membership percentage that has responded and ticked all the boxes on all of the alerts that we would have sent in 2023. So that's great to see. And then members with preventative services, 78.1%, up 2.9% from the prior year. This is a member having at least one preventative service. So that could be an annual wellness exam. It could be a breast cancer screening. It could be a flu shot. As long as they have had one of those services, they get counted in this number. And then lastly on here, you can see the Silver Sneakers participation. That's also ticked up. Good to see this returning to some activity level closer to what we saw pre-COVID. So people are returning to the gym at 11.3%, up 1.2% there. So I think the big message here, the takeaway is that, not unexpectedly, that's not uncommon that we're seeing increases in prescription drug spend. But it is happening as there are more and more sophisticated drugs coming onto the market, and your membership does take advantage of those medications. So I wanted to make you aware of that. I've got the same chart to share on the essential plan. So of course, this is a much smaller plan, and keep in mind, the benefits for this plan, the medical benefits are the same for both plans. Where they deviate are on the pharmacy side. So this plan has almost the standard CMS plan benefit requirement. So it's got the deductible and then co-insurances. It's got the coverage gap built into it as well. So members pay a higher cost for their medications on this plan. But you can see your average membership on this plan actually fell by just a small amount at 0.3% year over year to 5,234. And then the total net paid per member per month, that has gone up a bit, up to $927.58, up 3.8%. Looking at that based on medical and pharmacy paid per member per month, the medical is $788.13, up 3.8%. And then the pharmacy net paid up to $139.72, up 4.1%. So you can see here, people who are on this plan generally are not using high cost medications. And I think probably if they get into a situation where they are going to require some of those, they likely make a switch to the other plan for the richer benefit. Medical admits per thousand. Now in this plan, we did see a slight uptick in that, up to 141 admits per thousand, still below what we see on the premium plan, but up 1.4% from the prior year. Total number of prescriptions, 148,190. Barely changed year over year, just 0.1%. But we do see even here, a significant increase in the total number of specialty prescriptions. So we're up to 808 for the year, and that's a 12.2% increase. And then the specialty net paid is 5372, which is actually down 16.8%. So the members who are on this plan, even when they are utilizing specialty medications, they are the much lower cost specialty medication that they're taking. And then looking at the health alerts, again, great improvement here for your group, 48.8% in 2022, up to 60.7% for 2023. Members with preventative services also saw a nice improvement there, up to 73.4%. And then lastly, the Silver Sneakers also saw a nice uptick there, up to 11.9% of your members are utilizing Silver Sneakers. Questions on either of these plan performance data pieces?
I actually have one.
Sure.
The Silver Sneakers participation seems really low. How's that compared to the Go 360?
So those are two different programs. I can run some numbers on Go 365, but remember Go 365 is a incentive-based program. So if members are going to Silver Sneakers or just going to a gym, if they're walking, if they're participating in social activities, they can gain incentives like they would report those to Humana and then would be able to receive gift cards for those services. Included in that also is getting their preventative screenings done. So Silver Sneakers is simply the gym participation. They have online classes available as well. So that's participation there, and then you can get, rewarded for that through the Go 365 program.
Do you think it would help with that participation level? Because I'm looking at it from the well-being of our members. From the Go 365 that it was, is well received. It made a difference with the membership when they Humana held the under 65 health care, and I'd like to see that number come up because there's some sort of blitz or promotionals that we can do to engage people to maybe get back out more into the gym, and
Sure.
because online is great if you can't get out, maybe in the wintertime, but I think that social interaction has a lot of more
Right.
positive benefits,
Right.
both physically and mentally.
Right.
So I
Yes,
thought maybe we could do that.
we can definitely do that. I can work with Connie on that. A couple of things though, that, to mention, we did have Silver Sneakers present in October when we held our annual enrollment meetings. So they came and actually did a demo during those meetings, and we'll have them out again. So when we have those meetings in October, they'll be there. We are also attending the Kentucky Public Retiree Association annual meeting, and we'll have Silver Sneakers representatives there as well. So definitely we will take every opportunity to get out and meet with your members. Oh, and in fact, I do know Silver Sneakers has sent some representatives to some of the Kentucky Public Pension meetings, the Retiree Association meetings across the state. So we'll continue to do that as well.
And
Okay.
Tracy, just to clarify, you mean they were present during the in-person meetings across Kentucky during open enrollment, and
Yes.
you plan to do that? Okay. Thank you for that.
Yes, absolutely. Yeah,
Mr.
that's a great
Powell,
idea.
I would add that for the Plan Compass report that Tracy mentioned, where this data comes from, that we're going to walk through with Connie's team, and I think you all are invited to attend that if you'd like. In there, there's additional reporting about not only Silver Sneakers, but Go 365. The focus in recent years for Go 365, I mean, not only does it reward members for doing the things that Tracy mentioned, but there's a heavy focus on tying the rewards within Go 365 to members getting preventive care and closing gaps in care, things that are connected to the CMS star rating program. So things that really benefit the member's health, not just whether they go to a gym. So there's much more detail in the Plan Compass that we can share, but there are promotional activities underway for Go 365 to do sort of what you said, to encourage members to get back out there and to utilize not only Silver Sneakers, but the other benefits within Go 365.
Thank you.
Okay. Any other questions on the plan performance? All right. We can advance to the next topic. So we wanted to spend some time today talking about 2025 renewal planning. There is a lot going on. You've probably heard with the IRA and the CMS notices that are coming out. So I wanted to give you an update on what's happening with all of that and bring it some additional detail. We talked about this a bit in February. We shared probably something that looked quite similar to this, a timeline. But just to kind of remind everyone, so the Inflation Reduction Act really is bringing unprecedented change to Medicare Part D. It began in 2024 with the additional coverage for vaccines and then the elimination of the catastrophic copayment. So when a member reaches the catastrophic level of their benefit, their pharmacy benefit, once they've hit that, which is $8,000 for 2024, if they reach that level of true out-of-pocket cost, then they will not pay anything additional for their medications. In 2025, there will be even more significant changes coming to the Part D plan. It's really restructuring the beneficiary out-of-pocket spend, and that will now be $2,000. So the true out-of-pocket cost was previously $8,000, and then for 2025, it will be reduced to $2,000 per plan year for the Part D covered drugs. Your members will have an option also to smooth those costs over the plan year via a Medicare prescription drug payment plan. And we'll talk a little bit about that on the next slide. But before we get to that, I wanted to provide a little bit more detail here. So accumulation towards the $2,000 IRA MOOP or incurred cost amount is different than what the MOOP plan currently has, which is based on the retiree's out-of-pocket cost. So the current coverage gap will be eliminated. And then once the incurred costs reach $2,000, the plan will pay 100% of the benefit for the prescription drug plan. So this is a great benefit enhancement for members. It really should reduce a lot of the limitations and hurdles that lower income members in particular have had with getting the drugs that they needed. The new shared liability is established for the catastrophic phase. So once that $2,000 amount is met, is that the plan, Humana, will be now responsible for 60% of that drug cost. The manufacturer will pay 20%, and the government will pay 20% for brand and 40% for generic. As a comparison, in today's environment, we see, when a member hits that $8,000 threshold, Medicare pays 80% of the drug cost. The plan pays 15%, and the member may pay 5%, or well, in 2024, they're not paying anything. So this is a large shift in the way that these Medicare Part D drug plans are structured.
I'm a little confused on that last one there. Because the numbers just
confusing,
don't
y'all.
add up.
Well, so as I was reading that, so the Medicare
The
80%
40% generic is what confuses me
Okay.
with because it comes to 120%.
So in that case, there's no 20%. So that would be 60% is the plan's responsibility and 40% is the government.
All right, thank you.
Yep.
Yeah.
That clarified it for me.
And we have our head actuary, Penny, on the line if there's additional detail there to fill in. But the two takeaways from this slide for the committee members really is this is a fundamental overhaul of the Part D drug benefit starting in 2025. So there's been other changes, as Tracy mentioned, in the timeline that have already been implemented. 2025 is the big year. So it fundamentally changes the out-of-pocket exposure for your members in a good way. So that $2,000 out-of-pocket cap, it gets implemented, and the costs that accrue towards that $2,000 are different than what it is today. You will have members who will pay, who are on high-cost specialty medications, for example, and we saw some data about the utilization there. You will have some of those members who will reach that out-of-pocket threshold of $2,000 after their very first fill of the year, and then they will pay nothing more for the rest of the year. So that's good for them. They'll have the option to spread those costs out, even on a $100 copay, for example. They'll have the option to spread that out over the year, as Tracy will share on the next slide. And then after that point, they will pay nothing more. So that's the first key takeaway, is the improvement of the benefit for your members. And then really the takeaway, I wouldn't get too far into the weeds on the 60s, on the percentages listed at the bottom. Just the takeaway really there is that how the cost for those medications is shared between the health plan, CMS, and the manufacturers is changing next year also. So the benefit's getting better, and the cost sharing underneath that is changing also, and that has a negative impact on the plan, on the plan, i.e. Humana.
Can I say something here? We've recently went to conferences that include national, state, and local government entities, and there was a huge discussion at the roundtables about this. This does result in the white papers that are coming out, the actuarial analysis, are discussing cost increase around this area. So the premium is expected to change in that area. And there is a range based on the kind of formulary you have. So that's what, getting into the actuarial details will be a little more complicated, but just know that this means, if Medicare is paying less, the manufacturers are paying a little bit less. The premium is subject to possibly increase to a unknown. We'll know that more when we have the renewal come to us, but I just wanted to point that out. It is something that nationally everyone is watching and, of course, very interested in seeing how it turns out. Thank you.
Yeah, thanks, Connie. All right, next slide. Just wanted to take this is all, things are coming in from CMS and details. So we're learning more and more about, how this will be working. But we mentioned that there will be an option for members to smooth their co-payments, co-insurance over the year. So the MOOP smoothing will allow the beneficiary to smooth their cost. They will have a payment plan. They will pay $0 at point of sale. So they would pay nothing to the pharmacy, and then they would receive a monthly statement that they would make installment payments on for the medication that they are receiving. So lots of detail still to be identified here. And this will obviously whole different dynamic for members and for the plans. So the communication and helping retirees to understand how these things will work and whether or not these are good options for them to consider. Humana will be working and is working now, trying to make sure that we've got the right communication and the best way to explain this to members and to really to everyone, including you all. So more to come on this as we get closer to the fall. All right, we can go to the next slide, and I'm going to turn it over to Larry to talk about the CMS rate announcement.
Yeah, thanks. Good morning, everybody. So as we talked about with the IRA, significant changes there. Good for your membership, presents some funding challenges. And again, that's across the board. The federal legislation. The other component that we wanted to talk about is what we learned in the final CMS rate announcement. So this is an annual process by which CMS sets the funding for Medicare Advantage plans for the following year. So we received the final rate notice from CMS on April 1st. And I would point you to the two items that are in bold there in the middle of the page. There are two changes that were finalized in the final CMS rate announcement. The first is a change to the way CMS is calculating risk scores. So as you may know, every Medicare Advantage member is assigned a risk score by CMS that is a function of the member's overall health status, documented health conditions, et cetera. That directly impacts the amount of reimbursement that we get from CMS. So that's a member by member risk score calculation. So they, beginning in 2025, are changing the methodology that is being used to calculate that risk score. I'll let, if you're interested in the very technical details, we can answer any questions about that. The net impact of that is a decrease in CMS funding by a negative 2.45%. So we will see, same member year over year, we would expect a declining reimbursement of about 2.5% based on that change to how they are calculating the risk scores. The other change is really just sort of the annual changes that we see from CMS every year. So just natural changes to the amount that they would reimburse us county by county throughout the United States. On that metric, we are seeing those levels decline very slightly by a negative 0.16% on average. So our feedback to CMS when this was first announced in February and finalized in April is that the net payment change, as it says on the page there, is really just not sufficient to cover what we are seeing, not only with KPPA, as Tracy showed you in the data, but industry-wide increases in medical costs that occurred really beginning late in 2023. So our position is that the funding that we're getting from CMS is not keeping up with those increases in medical cost trends. So that, in addition to the IRA, the funding reductions that we are going to see from CMS for next year, are just going to be, another headwind that we're going to have to deal with.
And
So
Larry,
the rest of it,
I just
Yeah,
had a
go ahead.
question right there. I just wanted to say, is there any way you have any sort of an estimate? Again, at the Salgiba conference, I was hearing, different variations of this as well, but no true concrete costs. Some of the white papers maybe have predicted something, but I don't know if that's reflected in the actual analysis of this rate change. Thank you.
I mean, generally, I would say we're still working through what the cost impact is going to be. There's some estimates on the Inflation Reduction Act, what the cost impact would be there. It can vary widely depending on the drug benefit in place for a particular client and other factors. It can vary significantly. So we're working to finalize that for KPPA prior to our renewal delivery this summer. So can't give you any specifics now, but that's,
Okay.
we're working towards that, in advance of the renewal.
Thank you.
The items at the bottom, those are sort of just the mechanics of things that are changing. As Tracy mentioned, the standard Part D benefit that's in place on the essential plan, you can see the changes there. The deductible, I think we have customized for KPPA to stay where it is at a prior level. It's not even the numbers that are listed there, but that out-of-pocket threshold, material change there to the betterment of the members. Any questions about that rate announcement or the IRA? These are industry impacts. If you've listened or watched the earnings calls from Humana and our peers in the industry, we're all dealing with the same dynamics here. So we're all in the same boat, as they say.
Larry, I think you're going to do the next slide too.
Yeah. So as you all know, we do have a rate cap that we committed to during the RFP. So some of the things that I mentioned on the prior page, you are protected from a bit in the way of those year-over-year changes in funding from CMS. Unfortunately, though, the methodology change on the risk scores and the IRA itself were not things that were contemplated when our rate cap was agreed to a couple of years ago. So we will need to adjust rates above the rate cap due to those regulatory changes and the IRA. So use the item in italics there. That's the language in our agreement with KPPA. So we have never done that before, and we understand the impact that it will have on KPPA. And as I said earlier, we're working feverishly to finalize exactly what that rate impact will be before we deliver rates to KPPA. I think in June is our plan to get those out. Kenny, Carla, any other commentary that you would add about anything that we said?
No, I think you all did a great job of trying to cover it. It's a lot of information, a lot to take in, but we'll spell everything out when we deliver the renewal.
All right. Well, if there's any other questions, that concludes the material we had prepared for today.
It works so much better when I unmute myself. Thank the Humana team for the information and also I'm going to get it right here.
Took us a bit, Jerry.
But thank you very much for everybody being here with the information. Good information, gives a lot to talk about, and we look forward to hearing more from everybody. Does anybody have any other comments, questions, anything they wish to share? Hearing none, I will.
Jerry, I was trying to unmute.
Oh, okay, sir.
Yeah,
I know the feeling.
Yeah. Just a couple of minutes. This is directed toward Casey and Jose. We view relationships like this across the board, whether it's our actuary or investment managers or accountants or attorneys, outside counsel. We view it as really a partnership, and that sounds corny, I know, but we expect them to be constantly looking for ways they can improve their service, do it more effectively, do it more efficiently, and truly in a partnership fashion. And in the same manner, we look the other way. We're saying, we want to understand your needs, and we know that you all need to make a fair and reasonable return on your investment, and we understand that. I mean, and so that's our spirit going back the other way. And I think if you talk to the Humana folks, they would say the same thing. That we really feel we're aligned in this business. I do have a couple of questions, but I also it occurred to me. We have a little bit of a complicated structure. We have we have KPPA, we have CERS, we have KRS. If we can do anything to clarify that, if there's any confusion on your part, give me a call. I could easily clarify all that. I had a couple of questions though. One is the member survey that Humana has done in the past. What do you all do to get that kind of feedback for us and for yourselves?
So Jose, we do share annually a survey. We do an outreach to members on their satisfaction. And then, of course, we also do ongoing assessments from customer service utilization, net promoter score, that kind of thing. So that's what he's referring to.
Wonderful. Very briefly, so thank you for your comments. The spirit is aligned and shared. So thank you, sir. We also, much like Humana, survey our members as well, and all of the incoming calls as well as outbound calls that we make on behalf of our membership, both from a net promoter score and a CSAT member satisfaction as well. So we hope to continue sharing back, much like you received today, the reporting on overall satisfaction, overall member trends, and how we can work together to ensure that that continues, and perhaps build even more campaigns to increase engagement and satisfaction.
Yeah, I would appreciate it if you had a sample of an interview guide and or a survey content. I think we'd like to see that just to understand what you're going to be doing in that regard.
Yes, sir.
My other question is who owns your company?
Yeah, great question. We are private equity owned. New Mountain Capital is our parent private equity. Again, as Casey mentioned, we are not owned by an insurance company, which again allows us to really branch out and partner with various vendors in an agnostic fashion. But New Mountain Capital is our private equity owner.
And how long have they been an owner?
Over 2 years now. They have owned us. Again, we just merged with Virgin Pulse, who was also owned by Marlin Equity. And we do have other footprints. Casey, were you about to say something?
Yeah, during the merger, so New Mountain Capital has owned HealthComp for some time. During the merger in November, we are now also Marlin Equity stayed involved. They had owned Virgin Pulse. So they've stayed involved, and we have some additional capitalization through both Blackstone and Morgan Health. So there's really kind of four people at the table, but our primary ownership is with New Mountain.
And do they articulate their strategy going forward?
Well, the reason this all came together, their investment strategy here is to create something net new in the market, where we're placing the very busy front door of engagement that Virgin Pulse has created in the well-being space with the member service and cost reductions that we're seeing with the health comp on the health plan administration, putting everything into one member experience. So we're, again, personalizing the experience at the member level, at the client level. And, they really see that as market changing. We look at what Google did for search and what Netflix did for, watching entertainment. And the investment theory is to create that same kind of monumental change in the member experience and how people experience personalized healthcare in the market. So it's not going to be a quick turn that will do that, if that's what you're getting to. This isn't when we talk about mergers, there's often a lot of conversation around revenue synergy. The revenue synergy that our investment theory is on is really about investing and creating something that's really going to change the healthcare landscape. So it's not a quick play that we're seeing. Does that answer your question?
Yes, and thank you for doing that. By the way, I am the executive director. I didn't announce who I was, but I appreciate your comments.
Welcome. Thank you.
Mr. Eager, I mean, they, as our vendor, we hold them to the performance standards that we've agreed to with KPPA. Certainly all the cultural things that you mentioned went into, us finding them to begin with, and the work that they've done on other of our group Medicare clients and other clients. So, I think we share your desire to ensure that your members are handled properly starting next year, and that there's not some fundamental change, right after the effective date or something like that. So wanted to just add that comment.
Thank you, Larry.
And I kind of figured there were some sort of guardrails in there to keep it on the path. So appreciate it, Larry. Again, everybody from Humana. And I think I've got it now, is personify. So thank you all for being here. I kept wanting to say personality and I knew that wasn't it. So, but thank you all for your information. I look forward to working with all of you. And is there anything else? That hear nothing else, I will call this meeting adjourned, and thank you for being here today, and all the staff for the work they did in preparation. Have a good day.